Crohn's disease is an inflammatory bowel disease that affects your body's ability to be able to digest food, absorb nutrients, and eliminate waste. It causes the immune system to malfunction and your healthy tissues in your digestive system to be attacked, which leads to inflammation. Risk factors. Some risk factors associated with Crohn's disease include age. Although it can occur at any age, it affects young people between the ages of 15 and 30 most often. Cigarette smoking is considered to be the most controllable risk factor to developing Crohn's. Genetics. You are at higher risk if you have close relatives such as a parent with the disease. Your chance of getting Crohn's is then 20% higher. The main chromosome involved is chromosome 16 on IBD locus. The product of this gene is NOD2, which is a protein that is expressed in many types of leukocytes. The NOD2 mutations that is associated with Crohn's may reduce the activity of the protein, resulting in prolonged immune responses. And finally, ethnicity. This disease is most common in the Jewish and European descent, worldwide affecting 1 in 350 people. However, in Canada, it affects 1 in 150 people.
Physiology. Now we will cover the normal physiology that would be adversely affected with Crohn's disease. The normal physiology includes the gastrointestinal tract, or the GI tract. The GI tract is a long, hollow tube that extends from the mouth to the anus. The GI tract involves the following organs: the mouth, esophagus, stomach, small intestine, and large intestine, including the cecum, colon, rectum, and anal canal. The GI tract performs 6 essential activities. These include ingestion, propulsion, mechanical breakdown, digestion, absorption, and defecation. Food is ingested by the mouth and then swallowed into the esophagus where it travels to the stomach. From the stomach, the food, now called chyme, passes into the small intestine, the body's major digestive organ, to undergo further digestion and absorption of nutrients. The contents of the small intestine then move into the large intestine, where water is reabsorbed, and the body stores and eliminates residual matter through defecation via the anus. The wall of the GI tract is essentially made up of 4 layers: the inner mucosal layer, the supporting submucosal layer, a muscularis layer consisting of circular and longitudinal smooth muscle, and an outer serosal layer. Once ingested, food is broken down into absorbable units, and the nutrients move into the blood and lymph vessels by the process of diffusion. Pathophysiology. Crohn's disease is an inflammatory bowel disease that can affect any part of the GI tract, although in the majority of cases, it affects the distal small intestine or the upper large intestine. In Crohn's disease, the intestinal wall becomes inflamed due to the activation of inflammatory mediators that cause nonspecific tissue damage. The GI tract normally contains harmless bacteria that aid in digestion, synthesize vitamins, and may even play a role in regulating weight. Normally, our immune response protects us from foreign bodies and pathogens, but in Crohn's disease, something causes an unregulated immune response to be launched within the GI tract without the presence of potentially harmful pathogens and against the beneficial or harmless bacteria. The inflammatory response involves the release of inflammatory chemicals, including histamine, complement, kinins, prostaglandins, and leukocytosis-inducing factors. These chemicals result in arterial dilation, increased capillary permeability, and attraction of neutrophils, monocytes, and lymphocytes to the affected area. In an individual without Crohn's disease, pathogens are destroyed by leukocytes that pass through the capillary wall via diapedesis. Once the pathogens have been destroyed by phagocytosis, the inflammatory response ceases and healing ensues. However, in Crohn's disease, inflammation does not subside, resulting in chronic inflammation, ulceration, and the intestinal wall becoming thick and inflexible. The inflammation can affect every layer of the GI tract, but most predominantly affects the submucosal layer. This unregulated immune response results in the unpleasant symptoms often associated with Crohn's disease.
Symptoms. The symptoms of Crohn's disease can occur slowly or be asymptomatic depending on the individual. There can also be periods of flare-ups or periods of remission. Most symptoms are due to inflammation in the gastrointestinal tract. The common symptoms of Crohn's disease are as follows: fever and fatigue, abdominal cramps, pain, or vomiting, Both of these are due to inflammation or infection of the GI tract. Loss of appetite and weight loss. This is due to infection affecting the absorptive surfaces of the intestines. Change in bowel habits or diarrhea. This is because the damaged intestinal wall can't reabsorb water as well, so the excess water is excreted. Rectal bleeding. This is due to intestinal stiffness and narrowing, delayed growth and development. The more severe symptoms are inflammation of joints, eyes, and skin, or ulcers and/or fistulas. Treatment. There is no cure for Crohn's disease. However, the symptoms can be managed through diet and nutrition, medications such as anti-inflammatories, antibiotics, or immunosuppressants, and surgery if necessary.
Key concepts. Homeostasis. Homeostasis is disrupted when the immune system mistakes harmless bacteria for harmful bacteria, and it launches an unnecessary immune response in the GI tract, resulting in chronic inflammation.
Cell membrane. The body's ability to absorb nutrients via the cell membrane is compromised due to the gradual hardening and inflexibility of epithelial tissue. The cell membrane is also affected by the immune response in that it increases capillary permeability and causes swelling and abdominal pain.
Proteins. Certain cells, including neutrophils, monocytes, and lymphocytes, are attracted to the area in the inflammatory response associated with Crohn's. These cells perform phagocytosis and release proteins such as antibodies that normally protect the body from foreign pathogens but malfunction and begin to attack healthy tissue.